Hey everyone, and welcome back to my channel, Chat South Africa with Pammy T. Now, my name is Pammy T, and you are always welcome to stop by. Now, in South Africa, we have two major groups that are protesting against illegal immigrants using our public facilities. Now, the first being Operation Dudula, which is led by Zandile Ndabula. The second being Victoria Africa, who is from the Patriotic Alliance. Now, these two young ladies have committed themselves to keeping foreigners out of South African clinics so that the clinics can focus more on its country's citizens. Now, this also helps with easing the pressure and the workload for those medical professionals.
We are overworked in our facilities, Makabane, because of foreign nationals.
It also helps with the citizens actually getting their medication without being told that the facilities are out of stock.
I've been coming to this hospital for more than 3 years now, and every time I come here, there's shortage of medication, and I'm a South African citizen. I have these needles for insulin, and there's about only 16, and I'm supposed to use one each time. So there's a shortage of medication. Why? Understand? Yes. So I know what's going on in this hospital. I just want to know for how long will these guys be here? Because all the medication is given to the foreigners and we get less medication. Look at this. It's ridiculous. It's a bit faster now. Huh? Is it a bit faster now? It's a bit faster, but the lack of medication. That's the problem. It's ridiculous. Yeah,
Now, this operation has also assisted a lot with the waiting period.
Our clinics are empty. Empty. Our people can sit. Morning, ma. Morning. How are you? Good. You see?
You are doing great work at PD. You see how many of them went out?
You are empty.
And
You are
then
empty
there were so
inside.
many outside. You see people who are working there.
Ah.
And then, but disrespectful. You see, since they are not coming, the clinic is clean. Even the toilets, they don't.
Everything is clean.
They are putting a piece inside the toilet. You will find out the toilet is blocked. When you ask, yeah, I didn't know. In your country, we are doing like that. There are the first 10 patients in the morning here at particularly they are foreigners because they don't bath. They just take the kids
And come.
And the husband came early to queue.
For them. But now there's no one.
You see how many
It's
of them
empty.
went out? How many of them?
Yeah, and it's empty. But
And
besides it,
SPT clinicians were working them, and they are even telling us about our laws.
what rights? What rights?
What rights?
What rights do they have?
We don't know.
No, they don't have rights in South Africa. You see, they are talking about human rights now. Human rights is for South Africans. It was implemented for South Africans, not for the whole continent. So if they're going to tell you we have rights, then you tell them this rights is for South Africans. It's not for the whole continent.
We have no one here.
Now, obviously, this is a benefit to South African citizens, but what about those that are immigrants?
As you can see right here, they don't want the foreigners to enter the clinic, and there's also the police right here, and they are not even scared that the police are here. They're just doing whatever they want. And you know, look at all of these people that side there, all of these people with their children. They said that the sickness is coming. Instead of giving them the vaccination, they don't want. They say foreigners. They say some people from the outside suburbs are coming inside here to get vaccination. They are complaining.
So non-South Africans have been turned back. They've been denied access into the health facilities. Be it mothers that are there to vaccinate their children, it's no entry. Be it immigrants that are collecting their chronic medication, no entry. Pregnant immigrants going for their monthly checkups, no entry. No entry to anyone that is not in possession of a South African ID. So as far as I know, all this started after a South African citizen who was working in Zimbabwe was refused medical attention. And then the Zimbabwean officials stated that Zimbabwe was not a banana republic. The South African Zimbabwean worker was then flown to Limpopo, where he was met by the MEC of Health, Dr. Poppy Ramutuba, who assisted the man in getting the medical health care that he needed. I think that's when South Africans decided to return the favor, which resulted in all immigrants in South Africa being affected. Now, in South Africa, when it comes to healthcare, we have both the private and the public sector. Now, the private being centers where absolutely everyone is welcome based on your financial capacity, as they can be costly, with one having to pay for absolutely everything that is done to them. So all the tests, all the bloods that are drawn, all professionals that are attending to you should you need surgery or the likes, and all medication issued. At times, you'll just be given a prescription where you have to purchase the meds separately. So basically, everything you do at a private facilities, you need to pay for from your own pocket. If you have medical aid, then that's a bonus to you. Then there's the public sector. These are government clinics or hospitals. This sector is where you find Patriots and Ndabula members, as it is free of charge. Now with this, a lot of anger and hatred has risen between South African citizens and immigrants. Now, our South African Constitution states that free medical health care is on offer for all those that live in South Africa. Now, Zandile from Ndabula and Victoria from Patriots have tons of support. Now, the South African police have occasionally been called to clinics where immigrants have been denied access, but in most times they don't really do much, almost as if they are in favor of what the groups are standing for. So now my question is, who is the South African Constitution really working for? Who is it protecting? Whose side is it on?